Hi, I'm Dr. Paul Jared Frank, Director of the Fifth Avenue Dermatology Surgery and Laser Center. Today I wanted to talk about acne scars and their treatment. Most people look on the website, search the internet, read a bunch of literature, read beauty magazines about the various options for treatment. The fact is that there is no best option for the treatment of acne scars. You have to look at the skin very much like a road, and when there are acne scars, it's a damaged road. When patients have indentations in the road, we fill them. When patients have elevations in the road, we flatten them. When there are cracks in the road, we resurface them. So there are a lot of options that we use, from lasers to fillers to actual physical manipulations of the scars, whether it's surgical or using several different cosmetic acids. So the first thing you have to get your head around when you're looking to treat acne scars is that often the combination of several small things are going to make the biggest difference for you. One of the most popular treatments today, which you could review about on my website, is the use of fractional resurfacing or Fraxel technology. There are several Fraxels available. We have the Fraxel Dual, the Fraxel Repair, the Fraxel Restore. Again, there is no best. We need to find one that's going to be appropriate for you. The various lasers that we use, including the Fraxel, vary dramatically in their downtime, sometimes in their cost, and in their risk. There are certain ones that are going to be more appropriate for more severe patients than ones with just minor textural damage. Other lasers that are used are vascular lasers, such as the V-beam. We use this often for inflammatory acne scars, like red or raised scars. Sometimes that's combined with injections of cortisone. As far as pitted or indented acne scars, we very often use fillers. Generally, I use silicone microdroplets, which is an area of my expertise. It's a permanent filler, something that's done on monthly treatments where you're slowly building up the amount of filler. What's great about it is that it's cost effective, the effects are quite immediate, they're progressive as well, and cost effective because the filler is permanent. Most patients don't want to come in every 6 months for treatments such as that. There are some age-old treatments that we use with the use of chemical acids such as trichloroacetic acid. There's a procedure called the cross technique that I use, where we actually kind of infuse the trichloroacetic acid to break up the scar tissue in boxcar acne scars and in ice pick scars. For many patients, I often combine several of these treatments. Sometimes in a single treatment session, I'll use the cross technique, I'll use the V-beam, I'll use a Fraxel, and I'll use filler. And I find the combination of these things really give an overall additive, or what we call synergistic effect, almost kind of a 1 + 1 = 3. So upon consultation, when patients are going to come to my office, first we decide what kind of acne scars they have, and we try and find a treatment plan where we get a cumulative positive effect that's going to fit their cost structure, the quality of the skin and scars that they have, the coloring of their skin, and certainly their availability for downtime, because there's always a little bit of no pain, no gain when it comes to acne scars, but there are certainly different variations and variables that we could attest to, where we can do large treatments in small amounts of time, or we can really separate several treatments over long periods of time. So what I recommend doing is really take a solid look at the website. On the acne scar general page, you'll be able to have different links to the various procedures that I'll do. And most importantly, at the Fifth Avenue Dermatology and Surgery Center, we don't believe in one treatment. We have several options here. We have the most cutting edge of laser and cosmetic surgical technologies. I have up to about 20 lasers here, and we have a staff and a director, myself, who really have quite extensive experience with acne scars. So we wish you well, and we hope to see you soon. Thank you.